Welcome to the National Organization of Nurse Practitioner Faculty's podcast.
Welcome to the second series of the NONPF podcast, created by the Simulation Committee of NONPF. This year, our podcast series, titled In the Trenches, Confessions and Pearls of NP Simulationists, will center around the 2023 fall release of the NONPF Guide to Nurse Practitioner Simulations, a step-by-step approach. This guide, an e-learning book, was created by the NONPF Simulation Committee. The ebook is formatted to help NP faculty design effective, measurable simulations that address learner programmatic and national level competencies. Led by members of the current Simulation Committee, podcast moderators invite authors of the ebook to share pearls of approaching simulation from the perspective of the nurse practitioner.
Welcome everyone to our NONPF Simulation ebook podcast. Welcome to our show today. My name is Tedra Smith and I'm a member of the NONPF Simulation Committee as well as an associate professor at the University of Alabama at Birmingham. I am delighted to have with me today Bridget O'Brien, who's an assistant professor at Rush University in Chicago, as well as Mary Brennan, who's a clinical associate professor at New York University. Thank you both for being here with us today.
Thank you.
Thank you. So thank you, Mary and Bridget. I would like each of you to share a little bit of information about yourselves, introduce yourselves to our listeners, and also speak just a little bit about your expertise in simulation. And Bridget, I'll start with you.
Thanks so much. So I'm Bridget O'Brien. I am the program director for the Family Nurse Practitioner program at Rush University in Chicago. And many years ago, we really wanted to integrate more simulation into our program because we really wanted to have more time with students to really evaluate them clinically, firsthand, one-on-one, and the ability to really assess their skills in a different way than we had done previously. So as part of their clinical rotations over the course of a year, we have 12 simulation days that we've added into our program. And so it's kind of a robust and significant amount of time and energy that we spend on this. And I will say, in all transparency, in the beginning, I didn't know all of the standards, and then we sort of, jumped in with both feet without having all of this basis. So I've been very fortunate to now be part of the simulation committee, learn from all of my wonderful colleagues who have such expertise. And we've really built a lot of expertise here at our program here at Rush University as well. And so with that, we have had the opportunity to build a large simulation center and have a lot of integration of these theories and all of these things into our clinical simulation program.
Thank you, Bridget. Mary?
Thank you, Tedra, and thank you, Bridget. Yes, I am the program director for the Adult Gerontology Acute Care Nurse Practitioner program at New York University. And I would say over the last 10 to 12 years, we have developed about 12 simulations for the students to undergo before they graduate. 4 of those are interprofessional. And additionally, we have about 6 to 8 rapid response simulations in the last semester of the program. And we initially developed these simulations primarily because I felt the students needed practice in communication competencies. But once we started, I saw how important it was for students to demonstrate their performance of the different competencies. I'm also the chair of the simulation committee, and this has been a wonderful committee for us. So many colleagues who have such great experience in simulation, and I think we have all learned so much from it. And one of the outcomes of this committee has been this podcast, and this is our second season of the podcast. So we're just so thrilled that we can offer this podcast another year.
Well, thank you, Mary and Bridget, for giving that introduction and expounding a little bit on your simulation expertise. So we've come quite a ways with simulation as far as with nurse practitioner students and integrating it into graduate education. So thank you both for your contributions for that. Now that we're talking a little bit about our ebook and specifically the learning theories chapter, I would like for you all to open it up by discussing kind of the importance of theory in simulation design. Why would one want to use simulation and use theories together to build those simulations? And Mary, I'll start with you.
Sure. Thank you, Tedra. Well, I think simulation has become such an increasingly popular teaching and learning strategy in graduate nursing programs. However, the research base for this type of learning is pretty limited. I know educational theorists and leaders in nurse practitioner education have suggested that nursing develop a sound research base to support this technology and to determine how best to deliver and evaluate simulations. And I think in order to develop a sound research base, educational researchers need to incorporate a theoretical or a conceptual theory. And I think theory helps to tie a bunch of ideas together to establish a structure that helps to explain and predict learning. In this ebook, we reported on some of the studies that have incorporated a theoretical framework or a learning theory to support the simulation. And the theoretical framework really helps the researcher to align the objectives, the design of the study, and the outcomes of the study, but also helps to determine how that theoretical framework can help to explain how simulation cultivates learning, but also how it guides performance.
Thanks, Mary. It does, the use of theory and helping to align objectives and outcomes is really important to actually know if the simulation you design is actually helping the students meet the competency. So that is very important, ensuring that all of that is aligned. Bridget, do you have any comments in regards to the importance of theory in simulation design?
Sure, I do. So I think, theory is not something that necessarily comes naturally to everybody. They're not always thinking of, I need a theoretical model for this to base my simulation design. And that certainly was the case for me when I first started doing a lot of simulation. I wasn't necessarily incorporating a theoretical framework. But what we really have learned, and especially engaging with writing this chapter, is that it really is, such an important piece to provide that structure, like Mary said. I think it really anchors what we're trying to have our students learn and where we're trying to have them go in terms of developing their competence. And so I think this chapter really provides an opportunity for faculty everywhere to really figure out a way to use these theories and have some examples and some concrete literature that's out there. When Mary was talking about the fact that there aren't as many studies and stuff as we want, we also found that in our looking at theoretical design for this chapter as well, is that there weren't a ton of studies that we could reference. So we tried to provide some that were really helpful. If you say yes, from after hearing us today, you definitely want to add more theory into your simulation program. We give you some tools to do that.
Thank you, Bridget. I totally agree. Theory was not at the forefront of my mind when it came to simulation design, but throughout the years, it's become very important understanding that it kind of anchors the learning and structures the learning and is an effective way for you to test your outcomes and align with your objectives is very important. And so what are some of the theories used in regards to simulation design? If each of you could give us kind of an example of a theory that's been used, especially with NP simulation design, just a precursor of things that someone could learn from reading this chapter. And Mary, I'll start with you.
Sure. Well, thank you, Tedra. Again, I think it's important what both you and Bridget said, that sometimes theory is so abstract that we don't think about using it in our simulation studies and practices. But what we hope to do is demystify theory a little bit and explain how important it is, that how it does provide a unifying structure to develop simulations. When we did a review, most of the studies included 5 different theories: self-efficacy theory, Knowles' theory of andragogy, goal Kolb's experiential learning theory, Miller's pyramid, and rapid cycle deliberate practice. And I think self-efficacy was the theory that was used most frequently to cultivate a diverse set of competencies, such as cultural competency and interprofessional communication. And I just want to remind everybody what self-efficacy is. It's a belief in your abilities that you are capable of performing a particular task. And there are 4 tenets associated with self-efficacy theory. The first one is social persuasion, or having others tell you that, yes, you are capable of performing this particular task. Secondly, vicarious experience, or observing somebody else performing the task. Thirdly, emotional arousal, which pertains to an individual's judgment of their physiologic or emotional arousal when performing the task. And the most important tenet is mastery experience, which involves the individual performing the task over and over to achieve mastery. And I've highlighted one of the studies, which was conducted by Nemo et al. In 2021. And it was a study that was published in the Journal for Nurse Practitioners. And this was a study that actually looked at 2 different schools and how their students, I'm going to stop right here, sort of lost my place. And I will pick up here. 3, 2, 1. And they looked at whether a simulation-based learning strategy would increase the student's self-efficacy in providing advanced healthcare for Hispanic individuals who were living in a rural community. They compared students from 2 different schools. However, in one of the schools, the students had completed a course in transcultural competency, whereas the other school, the students just performed a simulation. And what they discovered, or the results reveal, that all of the participants actually improved, but the students in the school that had completed the transcultural course had significantly higher scores. And I think what we found when we looked at the 3 studies that use self-efficacy was that it was pretty important to provide multiple learning opportunities to cultivate self-efficacy, that just one short learning simulation or learning period would not increase self-efficacy, that the self-efficacy was cultivated after several different experiences. So this theory, I think, is very important as we educate our students to perform different tasks and really to help them believe in their abilities to perform a particular competency.
Mm-hmm. Mm-hmm. Well, thanks, Mary, for giving that very thorough overview of how self-efficacy theory can be integrated and used for simulation design. Bridget, would you like to expound on another theory exemplar for simulation design?
Sure, absolutely. So we have other examples in the chapter as well, but the one that I started using the most, because quite honestly, it was the most concrete and easiest for me to kind of follow, was the Miller's pyramid. So many of you may be familiar with the Miller's pyramid in many different contexts, but it was also tested in NP simulation design. So just to review, the Miller's pyramid really has 4 levels of the pyramid. The first one being the broadest level of what we call nose. That's the nose section, which is really testing knowledge through written exams. And we know that this pyramid of really developing clinical competence is in a hierarchy. So we start with nose and we start with building knowledge. But we also know in our NP programs that we really want to get beyond just knowledge transfer, that we're really looking for competence. And so we keep building on that. The next level is what we call knows how, or what Miller calls knows how. And that tests the knowledge application through things like clinical problem solving and maybe done in more of an essay format. So these may be something that you can, design simulation around. But really the next level up, where we talk about shows how, is where we're getting to most of the bulk of our simulation design. This is testing clinical skills through competence. And maybe we're using things like standardized patients or other simulation modalities. We may be doing clinical exams, such as observed structured clinical exams, to really have our students demonstrate what they're able to do by showing how. And then DOES is really the top of the peak of the pyramid. And this is testing clinical performance through direct observation in a clinical setting. So many of us can't go see our students as much as we want to in their clinical settings. And this is our way to really be able to directly observe them, get a true sense of kind of that, where they're struggling, where their strengths are, and really be able to assess that. So structuring our simulation programs or our simulation activities can really help with, having this intention of what the learning goals are. And I think that's where the theories really help with that. And then we take it further in the chapter to look at specific studies. So one of the studies we look at with Miller's Pyramid was by Sullivan et al. And that was really looking at the richness that goes on in terms of building simulation, in terms of testing clinical competence. So by using the Miller's Pyramid framework, they studied that they showed that this really did improve how much learning occurred, as well as how much we were able to evaluate the students. And so again, having that be that anchor for your simulation design can be really helpful.
Mm-hmm. Thank you, Bridget. I think you really covered it in great detail, and by explaining that it's a great way to assess clinical competence, and any of these theories can be used from the first semester student to the very last semester student. And it is really a great way to help you frame your simulation design, to assess for those outcomes aligned to your objectives. So a great way to use theories. And I think you kind of answered this question, but I'm going to give you another opportunity. But how can NP faculty use the Learning Theories chapter to guide their development of simulations? And Bridget, I'll let you answer this one.
Sure. So if you're someone like me that was maybe a little intimidated by engaging in theories in a profound way, I think this chapter is hopefully going to break it down a little bit for you. Our hope was that we were designing it in a way where we introduced the different theories. We don't introduce every theory there is to use, but we introduced many of the ones that are commonly used that Mary had mentioned. And we introduce what the theory is, and then we go through kind of the major tenets of the theory. And then we further talk about particular studies that we found that use this theory. So you can engage with the chapter by really, reading the content, getting to know how theory is used a little bit more, getting to know the specifics of the theories. And then you can take a much deeper dive on the studies that we have listed as well, and go to those references as well to really figure out how maybe another site has used it in a way similar to what you may consider using.
Thank you. Thank you. But we've come down to the end of our time for this section. Thank you both again for being here. I would like to leave with any final takeaways you would like to give to our listeners. And Mary, I'll start with you.
Sure. Well, my final takeaway is that knowledge is important, knowledge acquisition is important, but most important is the individual's ability to apply that knowledge in a specific setting. And I think what simulation allows students to do is to demonstrate how they are going to apply the knowledge they're learning in the classroom and how they're going to apply it in the appropriate way with a patient. And so I think because of that, simulation has proven to be a great technology to help with cultural competency, and it's consistent with the AACN Essentials, which is moving towards a direction of competency-based education. And simulation is just a great way to help us determine if our students are competent.
Thank you, Mary. And Bridget, your final takeaway?
My final takeaway is don't be afraid of theories. Engage with the theory. Really, it provides a great structure for our simulation programs. And it also helps us really remind ourselves from the beginning kind of what our learning goals are. And I think that's really important for simulation design.
Mm-hmm. Thank you. Thank you both for being here with us today, Mary and Bridget. And thank you to our listeners. Take care.
Thank you.
Thank you for having us, Tedra.
Thank you.
Thank you for joining us today to hear from our NONPF simulation experts. This podcast has been written, directed, and produced by David House, Jeannie Elaine Kauschinger, Tedra Smith, Jeannie Rodriguez, Leanne Barfield, and Queen Henry-Okafor. Special thanks to NONPF CEO Mary Beth Bigley. The digital ebook is available for purchase on the NONPF website to both members and non-members. The opinions expressed in this podcast series or any product mentioned are not specifically endorsed by NONPF.